Hey, so speech language disorder versus late talking. How do we tell the difference? Well, welcome back to our YouTube channel, and yes, let's do this. So we say someone has late talking when these children speak later than most of their peers. Okay, and by the time they're starting to speak, that language progression, the trajectory that it usually takes a normal trajectory. Okay, so these children will be quiet in their first 3-4 years, and then when they start speaking, they just shoot and speak everything. By the time they are 6 or 7, they are at par with their peers. So what are the key characteristics? Of course, the first one is the fact that they have delayed speech. But again, as I said, once they start speaking, well, they speak every single day, every single word. Actually, they start speaking in sentences. Okay. Then the second thing is the fact that they have normal comprehension and social skills. Yeah. So whenever you're giving instructions, whenever you're reading for them, whenever you're telling them to perform a specific task, they are able to follow the instructions to the latter. That is the comprehension. That means their receptive language is good. They are able to hear, they are able to understand, they are able to act on those instructions. And also, their social skills is also very good. Okay, that means they are not, whenever, for example, they are with other children, they'll be able to play, they'll be able to be proactive and, go to them, as opposed to other children with different developmental challenges. Okay, so they'll be able to be otherwise okay, except the fact that they are not actually able to verbalize. The third aspect of late talkers is the fact that they have catch-up potential, which means when they start talking, they are able to talk. By the time in a year, a short span of a year or 2, they are at par with their peers. So if they start talking at around 4, 5, by the time they are 6, they are going to be talking like any other 6-year-old. Then of course the fourth, which is one of the most important, is the fact that none of the other milestones is delayed. So their social milestones are good, their physical milestones are good, and of course when they start speaking, all the other things are also developing to catch up with their peers. And so you find maybe in a family of 3 children, they all start speaking at the age of 3 or at the age of 4. Okay, and when they start speaking, in 1 year, nobody will be able to actually pick that there was actually speech delay at any point in life in this child's life. Now, what is speech and language disorder? So we say a child has speech and language disorder when, yes, their speech is delayed, and even when the speech comes, they need some intervention. They need their growth is not as the trajectory of their growth does not follow the normal pattern of speech and language development of a typical child. Okay, sometimes this usually leads to other developmental challenges, or even sometimes organic, something like hearing loss or a neurological condition. So how do we say someone has a speech and language disorder? When they start speaking, usually the delays are persistent. They'll constantly be having difficulties in their language. Yes, they'll eventually, maybe for some, will be able to start speaking maybe in single words or in sentences, but even when you meet them 4-5 years down the line, you'll realize their level of speech and the complexity of their language does not match up with their peers. So you find they may have issues with articulation. That means the way they pronounce the words, the vocabulary, the grammar, and also the social communication, like looking at something or participating in an activity and then being able to express themselves. You'll find that they are going to be having challenges. Sometimes even the social skills are really also affected, and so they may not be able even to understand social cues. They may not be able to understand simple jokes whenever they are part of a group or maybe in a play, really based on their age. So typically, speech and language disorders most of the time do not really occur alone. They are usually part of bigger developmental challenges, things like autism, things like the global delay, things like speech apraxia, like problem with the way the pronunciation is. Sometimes they're part of the hearing impairment, sometimes they're part of the intellectual disabilities. So most of the time you find speech and language disorder is just a representation in one of a more complex developmental challenge. So of course, as a parent, as you watch this, you're asking, okay, so as a parent, how do I really tell, is this child a late talker, or does this child actually have speech and language disorder? So the first aspect of any child is ask yourself, Does your child comprehend? And these are some of the questions we always ask you. When you give simple instructions in the house, maybe go bring me a spoon. Will your child be able to go and actually know this is actually a spoon and I'm supposed to take this to mommy or to daddy? Or will they go and just stand and not even understanding what they were sent? And the second thing you need to ask yourself is, how are the social skills of your child? Okay, simple things like eye contact, them knowing their name, them participating in playing with other children. How easy or how comfortable are they when it comes to those social interactions? Then the third question you need to ask yourself is, yes, for example, they've just started, saying the first word or the first sentence. The vocabulary used, the grammar used, the way they express themselves, does it make sense in the situations? For example, I am happy, and then instead of saying I'm very happy, I say Tom is happy. Okay, so I refer myself as a third person as opposed to me. Okay, so something like that. So does the vocabulary and the structure when it comes to use of language, is it normal? As we have said, late bloomers or the late talkers, usually whenever they start talking at a very high level. Like actually they start speaking in sentences, as opposed to a child who has speech and language disorder. They'll start speaking, but they need constant interventions, lots of therapies for them to be able to catch up. Then the fourth aspect is, have you ever introduced your child to play? For example, either you've taken your child to a play group where they play with other children, or maybe you've even started speech therapy, and how are they responding? So late talkers, these are children you find a typical parent will tell you, my child was not speaking, and when I took him or her to school, they started speaking, and now they're speaking like any other child. Those are late talkers. But a child who will be taken to school, and then yes, they start speaking, but still the way they pick up language is slower than expected, then most likely you are dealing with speech and language disorders. And then of course the fifth thing is their behaviors. How is their behavior when it comes to just them being themselves? You find a child who's not speaking, or maybe they have few words, but they're constantly speaking. Okay, or they're constantly fidgeting, or they're constantly on tiptoeing, or when they're excited they make these noises. Okay, those are not typical behavior of a child. Okay, so whenever you see your child has speech delay, and then they have behaviors that you're also not able to understand, then most likely you could be dealing with speech and language disorder as opposed just to late talkers. So if you have a child who's a late talker, I would really recommend, you think your child is a late talker, take them to school, take them to play group, and see how they respond. Okay, but as I always say, when you get to 1 year and your child is not speaking anything, please make sure you check your hearing, the hearing of your child. It's very important. We all learn language by hearing it. Okay, so once you have confirmed that your hearing is actually normal, then that's okay. You can now consider going to play group and then see how they are going to respond. Okay, but if you, for any reason, your child has behaviors that you don't understand, your child's social skills are a bit also off, your child has mannerisms that you are not able to understand, or people have actually been commenting about your child's behavior, then I would really recommend that you actually see a pediatrician. Please see a pediatrician. They'll be able to assess your child, and they'll be able to give you a plan on what you're supposed to do next. Okay, so if you're watching up to this moment in time, please go ahead and subscribe and share this with as many parents as possible. And even more important, I'm going to tag a questionnaire at the description box, where you'll be able to just tick and see, am I a late talker, or is my child having a speech and language disorder? And maybe we'll be able to see how best we can help each other. All right, till then, bye.